So my name is MK O'Connell, and I serve on the board at the Search Fund Alliance. We're an organization that really works towards deepening the partnership between search fund CEOs and investors. And one of the forums where we try to help is by hosting these roundtables to tackle kind of key topics of the day. Obviously, this is a topic that's top of everyone's mind right now. And as we were discussing it at the SFA, at the board, I was talking to the CEOs about resources that they may have known to help CEOs address coming back to work in a pandemic. And Alex launched into his experience managing his company through the teeth of the first wave of this. And what was interesting is it really came down to leadership more than anything else. And then Hal talked about his experience much the same way. And so with that, we had established the theme for today's conversation. And with that, I will pass it to Steve Lee, our moderator, who works with John Herzog at the Search Fund practice with Goodwin Proctor. So Steve, to you.
Great, thanks very much. And very nice to meet all you folks virtually. I figured we would start if we could give Eric and Hal and Alex maybe 2 minutes each to talk about their company and what they're doing. And then we'll launch into some questions that I know are probably top of mind for folks. So Eric, do you want to kick us off?
Sure. So my name is Erick Laseca. I'm the CEO of American Vision Group. We're an eye care MSO based in South Florida with eventually a national footprint. My partner Giovanni and I met in business school, and we launched Neurotech Capital, and then we formed American Vision Group. It's 5 eye care practices with 3, and we've acquired 2 since, and we'll continue to acquire along the road. We're acquiring the next one in July. So we got slowed down a bit by COVID, but we're still kind of getting back on the saddle. We had 182 employees before COVID. We're going to end up with 190 after we fill the vacancies that we've created. And so no contracting there. In the depth of COVID, obviously that's the difference. We did have 30% of our staff furloughed or working from home, about 60 that were working less hours. And then the management team, which rounds out the rest of the team, got a 20% salary reduction. So we, and obviously the doctors who are on a percentage of collections, all took a hit. So we all kind of spread the burden of, the economics that everybody's going to go through, and really kind of came together from this. I'm excited to talk about, some other things we did when we get to that in the conference.
Great, thanks. Hal, how about you?
Yeah, Steve, I'm Hal Mottet. I've proven myself time and time again to be a Stanford admissions mistake because I didn't go to Wall Street. I've run a succession of gritty manufacturing companies. Right now, I'm interim CEO of Craftsman Unity Cutting Dies, which was deemed an essential manufacturer by Homeland Security because food and pharmaceutical and household goods producers can't ship their products without our products, which enable them to do that. We now have 4 primary manufacturing facilities, 2 in California, 1 in Arizona, 1 in New Jersey, and went into the coronavirus pandemic with 180 employees, about which 3/4 work on the floor in factories. It's gritty, it's labor intensive. Our guys don't have degrees, often don't have high school diplomas. They're salt of the earth, hardworking people who put their clothes on each morning and come in and work hard to support their families and themselves by making cutting dies and printing plates.
That's great. Thanks very much. And Alex, how about you?
My name is Alex Stavros. I'm the CEO of Embark Behavioral Health, have been for the past 10 years. The first 5 years, Hal Mottet was on our board of directors and is a great mentor, coach of mine. And Embark Behavioral Health is an adolescent mental health behavioral healthcare provider. We have 1,200 employees around the country in 16 states. We operate the full continuum of care from outpatient centers to residential treatment centers to wilderness therapy programs. And we have a headquarters with about 40 people in Tempe, Arizona, and then have another 30 people, also part of our headquarters in Bakersfield, California. Those 70 people are the only ones out of 1,200 that had a kind of work from home structure. Everybody else continued to go to work, obviously in our programs. We work with adolescents struggling with anxiety, depression, and issues of suicide. Our long-term residential treatment centers have a length of stay of up to 12 months. So we have a full-blown school with electives and teachers, and our wilderness therapy programs are about 90 days length of stay. And we have our outpatient intensive programs, which are a few hours a day, but then they go and sleep at home. Obviously our programs are unique in the sense that we have licensing and accreditation requirements that revolve around infection control. We always have. Most of our programs also have full-time 24/7 nursing, as well as doctors involved and on the payroll. So those needed to be beefed up during this time. We started our coronavirus task force the first week of March that met daily since then, ensuring that we understood what the best practices were in terms of face masks, in terms of cleaning supplies, in terms of tracing and isolation and quarantining. We had one student who was infected in one of our programs in Utah. We quarantined, isolated, traced. There were no infections or no spread of infection from that. It was a program of about 70 students and around 100 employees. And then we had one staff member in our program in Houston who was also infected, and there was no spread from that either from our interventions around tracing, quarantine, and isolation. Both those cases were mild. In neither case was fever above 100 degrees. And most recently, over the past month, people have been coming back into the office here in Tempe and in Bakersfield, where we had the option to work from home. And so that's some context background on Embark Behavioral Health. And it's a search fund. Now is majority owned by a private equity company. All of our individual search fund investors are still investors, however, even though a private equity company now owns the majority. It's been 10 years.
Great, thanks very much. And so before we get into the questions, I just want to do one programming note, which is that if you have questions, I think April just sent out a group chat. Feel free to put in questions in the group chat or directly to April or myself, and we'll try and get to those throughout the course of the presentation, and then we'll leave some time for a Q&A at the end as well. So jumping straight into it. So we're obviously living through a time where there's very little historical precedent. And when you have to navigate a crisis without a playbook, it helps to have a set of core principle values. Did you guys find or develop any core principles to help you guide you through, this time period? And maybe we'll start with Eric.
Sure. Yeah, so we did have a set of principles. It was a combination of transparency, compassion, and fiduciary responsibility. So the transparency part of it, we started off early on with daily emails or near daily emails that talked about what the curfews or new stay-at-home orders were, what actions we were taking as a result. We eventually talked about shared patient volume, and then attached that to kind of daily production. So we were very transparent with the staff because we're part of a team, and we're going to eventually things were going to eventually get better, which leads to the second point, compassion. We knew we were going to get out of this. We knew there was going to be a post-COVID. And so we wanted our team, which we respect and value and love, to be okay and to be able to come back. And so we wanted to spread the hours as opposed to having a subset of employees that gets to work. So we gave that option. Like I said, there were some folks that were furloughed Majority were just working reduced hours, or management was working a whole lot more. But you know, the essence was we all wanted to take a hit. Everyone from the doctors down to the front desk saw a smaller paycheck, but all had the option to see a paycheck and come to work if they wanted to. And then the third part was fiduciary responsibility. I think doing the first two things right, we can come. It's not a zero sum where, you know, the investors are happy and the staff isn't. So we have a fiduciary responsibility, and that's why the transparency is critical, because as we saw less patients, we, you know, cut on hours, and that was a direct result of some, you know, curfew or new stay-at-home order. So it really, it built on itself, and people really appreciated that level of understanding, because it's more easy to swallow when you're working, you know, half of your normal hours, when you understand and that, you know, everybody else is taking a hit too. And so we were really cognizant of that, and that really, those three principles really guided us through it.
Right, great. How about you, Hal?
So we looked at this crisis as a real leadership opportunity. You don't actually get these opportunities to be a leader like this that often. And there's a real need and a chance for us as CEOs to shine and really provide some help and service to our team, our tribe, our family. The coronavirus thing in our thought process here in our lead team was that this is an opportunity that exists at the intersection of, you know, fears being stoked by the media and instincts to save yourself, and really the reptile brain intersecting with scientific facts, you know, rational thought, and our humanity that transcends the reptilian instincts that we all have. And so what, you know, the question becomes, in this time of extreme fear, what do our people need? What do they need at the start of this? What do they need now as we pull people back into our organization? So, you know, the answer is, to us, a very human connection and communication, and a lot of it. And I think this follows on to what Eric said. You know, it's we in a leadership role, the chiefs, it's in our title, right? Chiefs of our tribe, showing cohesiveness. We're sharing the risk and the pain and the loss and the suffering, and we're all supporting each other. And again, this operationalizes itself for us in general managers of facilities with their lead team standing in front of our people at shift change, when everybody's together every day and talking about sort of going beyond the facts, going beyond the media extravagance, and sharing sort of CDC. Our big source of information in all this was the CDC website. Our HR manager, great young guy, Augie Avalos, would go to the CDC website and prep a news release, our news, not the media. And our people would stand up, our leaders would stand up in front of our full team and you know, take turns sharing all this information. All of this is a way to overcome that fear, because we had to operate. Our customers, you know, may have been at reduced operations, but we needed to continue to serve them. It also operationalized itself, and like I said, many reps, you know, those were daily meetings. We were making sure we were sending this message every day that, you know, here's the facts, regardless of what you're hearing. And remember, at the beginning of this thing in March, there were tremendously scary news stories out there, you know, of how virulent this is, and et cetera. So we had to, through these reps, we had to sort of change our ethic. You know, our normal workplace ethic is that go ahead and come to work if you're sick. You know, these are a bunch of tough guys working on a factory floor. They don't stay home for a cold, you know, and we had to change that effort through reps from instead of coming to work sick and toughing it out, guys. Now, if you have a runny nose or a sniffles, you got to stay home because we're going to take care of you. The government's passed these programs, you know, real soon on there was extra sick days for coronavirus and stuff like that. So, you know, we really had to get this message across. We're going to support you. We're going to be here for you. Don't come in sick. Stay home. You know, and we've gone through a lot of these things. Another thing we did is we said to our employees, hey, we'll furlough. Anybody can go on a furlough who wants to. If you don't feel safe coming to work, we're going to be here. But, you know, and we're going to work and we're going to get our orders out to our customers. But if you have a family member who is compromised, if you have, you know, an illness yourself, you don't even have to tell us what it is. There's no questions asked. If you don't feel comfortable coming to work, we'll furlough you. And we had about 20 out of 180. Primarily, the greatest concentration of furloughed people were at our New Jersey operation, which of course is near the epicenter, right? It's right across the river from Manhattan. So we had about 20 people stay home. Now here's the rub. Some of these people, our business volumes have picked up. We've always said all along, if you feel comfortable coming back, come back. We've now got most people back. And as they came back, there was a lot of coaching, a lot of social distancing involved touching, touches, touch, you know, not physical touch, but personal touch to get people comfortable. Much like Alex, we just had very few people whose jobs could be working from home. Most people are engaged in an actual activity that has to be done here in our factory. And so, you know, we've still got a few people working from home and just a few people out on furlough, but we've got everybody back, and it's been all about that leadership of showing cohesiveness and support. Just one other thing, you know, we did, like I took no salary. All the salaried folks took a 20% hit there pretty early on when our volumes were really impacted, and our hourly people, we asked them to take a 10% hit. We restored those 4 or 5 weeks ago to where people are getting their normal rates of pay again. And as the volume came back, and also because the government responded strongly, you know, in 2009 when we had the recession, you can say the response was late and muted. Man, this has been an overwhelming response, both fiscal and monetary, from the government. And we benefited from a 3P loan. We're kind of a poster child for who that loan is supposed to benefit. And so as soon as we got that 3P loan in April, it was April 23rd, we restored everybody's pay. And, you know, that was very helpful. Really appreciate that. Hey, with that, I will sort of conclude this comment. The biggest, if you call it a principle, it's the principle that we as CEOs have the word chief in our name, and our job is to provide, you know, a lot of times we're making decisions about acquisitions or this or that or the other thing. But really what we are is we are the chief, we are the leader. We have to step up at times like this and really show it and be in front of our people and there and talking to them and, you know, being available. And that, I think, is, we only had one instance where we had somebody show up sick. We had a number of people who, this was in March, we had a number of people who split that afternoon when the word went around, the rumor mill worked, you know, and guys went home. But we called everybody and we did some cleaning and we you know, did all the things that we needed to do, like thermometers when people came to work and all this stuff. And we got everybody back on Monday. So I was very pleased with that. It would have really impacted us if that had spread or gotten worse. And thankfully, we've had a number of people that have gotten sick and tested positive, but we have not had a mass spread of this thing. I left out a lot about social distancing and wearing masks and all that stuff because I thought the leadership stuff was more important.
We're going to get to that.
That's our story.
Yeah, we'll get to that in the next question. But how about you, Alex? Do you want to give us some guiding principles?
Yeah, the only thing I'll add is just in terms of the importance of having clear culture in your organization. And by culture, I define that as a core purpose, and core values, a vision, and a big, hairy, audacious goal from Jim Collins. And I think that's important because as leaders, as much as possible, you want to anchor your people. And whenever there's, including what's happening now in terms of the protest and Black Lives Matter, is what do you need to do as a leader? And I need to respond to this, or I need to respond to this. And then my people are telling me to do this. And so if we just react to everything, it becomes difficult. The other thing is, as a leader, you can choose not to be reactive, but you go to some playbook or Harvard Business Review and react in that way. I still think that falls short. The best thing we can do is to reiterate, why do we exist? Why are we here? What are our core values? And let's make sure we take this opportunity to live those core values, to reinforce why we exist and make decisions that help us get closer to our vision and our goals. And so in good times, you talk about that stuff. In bad times, you talk about that stuff. When you reprimand people, you talk about that stuff. When you reward people, you talk about that stuff. So that consistency and predictability of a leader provides your organization a way to lean into it and feel comfort that we're on the right path. Okay, that's common. So now is not different. So now we don't throw everything out the window. And that really helps, I believe, an organization calm. Obviously, the clear stuff about constant communication during times of crisis is probably the most important thing. If you have core values that are related to compassion and empathy, this is a great time to use those core values, or service. But also just reminding people about why you exist, why we're here, and whatever happens around us, our reason for existence does not change. Our core purpose is, if identified correctly, is enduring, no matter what. 100 years from now, that core purpose is still relevant. Coronavirus or not, your core purpose is still relevant, and that's why we're here. So I think we're finding that. If your organization does not have that, use this as an opportunity to really solidify that. If your organization does have it, use this and every opportunity as a leader to reinforce your culture, and always provide that as a lens.
That's great. Thank you. So before we started the panel today, Alex, you were talking about how Arizona is starting to open up and getting everybody back to work. All of you guys have been deemed essential businesses, so you've been back to work. You've never left work. You've been at work this entire time. So you guys have a head start on all of us. So maybe can you guys tell us how you managed your workforce during this period? How did you get them back, or how did you get them coming into the facility every day? And what were your kind of, the guideposts that you used? Were you using, specific resources like, how you mentioned CDC, state and local regulations, just how did you guys manage your whole workforce during this period? And maybe we could start with Hal.
Sure, Steve. Following on what Alex said, the sort of key thing that we said over and over again was, and sort of goes to that core mission, core value. So, we're essential in the supply chain for providing packaging. Now, this is not like saving a kid and a family like what Alex does, or helping people to see better like what Eric's company does. But what we've said over and over again, and it's kind of a mantra, is what we do is very important. It's part of how people get food, how they get medicine, how they get toilet paper. And this is all very important. What we do is essential. The government has deemed us essential. We recognize we're essential, but nothing we do is worth risking yours and your family's life. And this has been repeated over and over and over again. Again, we've gotten a lot of reps in as leaders lately, right? Reps on that, stay home if you're sick. Reps on this safety message of we're doing essential work, but it's not worth sacrificing yourself, your family, and your friends for. We'd rather have you stay healthy so you can live to come in and be here to make those cutting dies and printing plates next week. You know, we'll still need those next week, and we'll still want you here, and we want you healthy. And I guess just, you know, that message over and over again, and supplemented, Steve, like I mentioned before, the CDC website has been absolutely fabulous. We've used some other sources. You know, our county's gone right, they've gone left, they've zigged, they've zagged. We can't keep up with them. The CDC has just evolved continuously to greater and greater levels of knowledge. We followed up in Minnesota, there's an infectious disease website. I'm sorry, I don't remember the name of it, but we followed that pretty closely as well because there are other sort of leading edge things. But trying to take those CDC facts, simplify them, boil them down to what our people need to know. This is why we have extra people walking around with buckets of chlorine water, Clorox water, wiping down workstation, wiping down the bathrooms, wiping down tables, you know, whatever. And, you know, just taking those CDC notes and operationalizing them and showing them over and over again. We care. You know, we want you to understand our message. It takes many, many reps sometimes, you know, to get through, but that's what we did. Did I answer your question, Steve?
Yeah, no, that's great. That's a great answer. How about you, Eric? Any specific things that you did in terms of getting your doctors and your other people in?
Yeah, so we followed three sources to get our folks back. CDC was the kind of the guardrail for us. And CDC is followed by, you know, federal and state and local entities. So, you know, they were the most logical, you know, kind of first step. We also followed the Academy of Ophthalmology because they dictate, you know, routine procedures and elective surgeries. They put a hold on that. And so we were waiting on that. And in order to communicate to patients and to referring providers that, you know, the game on again. And then finally, state and local, because obviously the state and local, when the governor would usually release something, which was typically on a Friday, we knew that Monday, the following Monday, you know, we had capacity and we could open up locations. So we would look to those openings and then kind of get the volume of patients back up so that we were, you know, maximized as possible. So those were the three sources. Like you mentioned, we never really closed. We couldn't do much from home except a handful of people that did some billing or something like that, but we're patient facing. So we have to be in the office, in the clinics, all 12, or at least, you know, a majority of them. And because we're healthcare, we had great protocols to begin with. So we were always very clean, and we always had a higher standard, you know, than most industries, and especially eye care is even a higher level because, you know, we do a lot of procedures in the office or in the surgery centers. So, you know, it's obviously a higher standard of clean. And now what we're doing differently, in addition to the CDC protocols, is we're wiping down stuff in front of patients. We're doing things so that the patient fear, which Harold alluded to, or you know, the consumer fear, which is the biggest thing, is assuaged a bit, because if, you know, they don't see it being cleaned, it wasn't cleaned. So we're being visible even in how we do the things that we would have done anyways.
That's great. Yeah, I think that's a really interesting focus, because, you know, Hal's worried about making sure his employees feel comfortable and they know that cleaning is happening, but you also have that other management because your doctors and clinicians they know, you know, safety precautions, but you're doing a consumer facing, you know, kind of fear alleviation, which I find fascinating. How about you, Alex? Anything that you want to add on this?
So we've been through a lot of iterations, you know, be it the work that University of Washington's done, or University of Minnesota, like Hal mentioned, or the CDC, or the WHO, or Johns Hopkins University, or your local county. Those you know, those change constantly. And and early on, we had daily task force meetings and calls every single day for 30 minutes, and we'd review that. And we had contacts with the CDC relationships, just given the number of people that were flying across the country to our programs, enrolling and discharging, and just like with elderly homes, obviously we're not as vulnerable just because of how this what this virus attacks, or those that are most vulnerable, not the younger population. But still, we were inpatient and we were remaining open. So we had direct contact with a number of these organizations. People don't really know what to do. And I think Hal was mentioning about being a leader, and I know there's a lot of talk out there about listen to the scientists or CDC. You should listen to them, but you need to make your own decisions. And you have to realize that as a CEO, who are your stakeholders? And your stakeholders are your employees, are your investors, are your customers. And so be as connected as possible to them. What are their needs? How do they need to be led? Don't be as connected with, well, the CDC is telling me to do this today, so I'm now going to do this. And tomorrow I'm going to do that because that's what they said. Be connected to your stakeholders. The CDC, the WHO, and the county, they're not your stakeholders. Now, if there's laws that are passed, be aware of those laws in your county. Other than that, be really connected to your people and really connected to your customers. I would say that, you know, again, of our 1,200 employees, 1,100 or more than 1,100 never worked from home. It's been business as usual in terms of going into work every day and leaving every day. But we've had a lot of iterations in terms of obviously thermometer testing and mask wearing and cleaning and then a lot of protocols. And we ended up taking a leadership role in our industry because of our size. And we led a lot of weekly webinars for programs across the country and organizations across the country when it comes to behavioral health and mental health treatment, and what best practices were. So we created protocols and best practices and policies and procedures and shared those, made them public for people, and did webinars where we shared what we were doing and why and what those best practices were. What's the best way to trace and to quarantine and isolate, and how to, what's the forms you want to fill out and how to fill those out and when you fill them out, how to deal with symptoms and addressing those. So we did all that. I don't think that there are many on this phone call that had that similar experience in terms of that, you know, they continue to operate through all of this. And I think that my experience has been many in CEOs that I've spoken to, be it in my YPO group. For what it's worth, there are many companies that are coming out of nowhere looking to sell you a service on how you should open up. And they have all sorts of bells and whistles. And the more bells and whistles and the more serious they can make it seem, the more you're going to pay them for their services, because then you're going to think, geez, this is so complicated. I don't know how I can open my office back up and bring in this. And then you don't do it, or you got to hire these people and pay them $20,000 to then do a bunch of other stuff that if you talk to your employees, they don't want to go back to work if you're going to do all that stuff. Why are you bringing me back to work if you're going to make me do all this stuff? And then you take a step back and you realize, I guess that kind of makes sense. So either don't bring them back to work or simplify things. And when I say simplify things, that's been our learning in terms of, we definitely, when we have inpatient residential treatment centers, infection control, licensing, and the risk of fast virus spread, we had to be at the top of our game. So we've learned all that. Now, what I would say in the learning is that 95%, to pull a random percentage out of the air, of CEOs and businesses are overthinking reopening their offices. And particularly when I just say an office where your people come and do their work, like this office here. And I'm not saying when if you're a restaurant or if you do eye care and you have customers coming in, that's a little more nuanced. But you have to be connected with what your customers want. Do the things that will allow your customers to come back. And and certain people don't require that much of a hurdle. So be in touch. And then when it comes to your office, realize that a lot of your people are afraid. So as a leader, try to normalize that, help them understand. And it goes back to the basics of wash your hands. If you don't feel comfortable coming back to work, you don't have to. And we're going to have everything you need in the office. We provide it. There are masks available if you want to wear a mask. There's cleaning supplies. Our cleaners come in 3 times a week. Usually it's once every 2 weeks or once a week. We're replacing our air filters every 2 weeks. We usually replace them once every month or 2 months. There's hand sanitizer that's handled. And don't go into don't stick 20 people in the conference room. Feel free to have one-on-one meetings in your office. And so you really kind of normalize it for people. And listen, if you want to pay me $20,000 to give you that advice, I'm happy to take your money. But other than that, I really discourage you signing up for all these new businesses that are popping up left and right to sell you services to open back up, and to really think about simplifying things. And you know what? Have a targeted approach too. So those that are vulnerable, it is very clear that those that have these specific comorbidities and are of an age, and the reality is we're really looking at 70, 80 plus year olds, and I don't know how many 80 plus year olds you guys have as employees, but those people are high risk, and you should figure out a solution for them. But there are other younger people, maybe in their 50s, that have some serious comorbidities. Figure out a solution for them. Other than that, just get your people back to work, and just using common sense. And that's what we've done in our office here in Phoenix, and we're doing an office in California.
Yeah, I don't know if you've been consulting with lawyers, but I mean, in that advice that you just gave, you hit on a bunch of the core things that we lawyers always talk about, right? Which is, you can't force people to come in if they don't feel uncomfortable. That's a bad thing. The other is that if you have a requirement for masks or, a recommendation for masks, you have to provide them. You can't force people to bring their own. So, I mean, all of that stuff is great. And actually, maybe we can go back to Eric and then back to Hal. Do you guys have you guys implemented specific best practices like, social distancing, shutting down a conference room? I know, Hal, you've got feelings on temperature checks. So Eric, maybe you can start and we'll get to Hal.
Yeah, so we have a whole set of best practices. We actually created a COVID-19 information page for practice websites. And so it gives patients, what to expect when they walk into the practices. They can't bring a guest, usually some of the older retina patients. So our staff isn't in our 80s, but some of our patients are, especially some of the kind of the degenerative macular degeneration patients. So that's our core, bread and butter on retina. And so they usually come, 2 or 3 with that person. And so we have to have one person wait in the car, or whoever comes with them wait in the car. So we have, protocols around, guests and staggering patient scheduling. We don't do that. We don't put as many patients in a given hour. We don't expect no-shows and then stack the deck and expecting the no-show rate to hit. We are only based on what we can expect if everyone comes in 100%. So we're not stacking the deck there. We have shields at the front desks, floor to ceiling shields if there is no desk or on top of the desk. Everybody's required to wear face masks. Usually people did before, now it's an absolute requirement. Anybody that's patient facing wears face masks. There's stickers on the floor every 6 feet leading up to the front desks. And those are the major things. And again, the public facing kind of wiping down of equipment and the front desk and the waiting area is important as well.
How about you, Hal?
Yeah, so, some of the things we've done is we moved work cells at least 6 feet apart. And so the social distancing thing, we provide everyone and have required up until this week that everyone wears a face mask. And we've made a bunch of different rules around cleanup and just we've hired extra people to clean or had extra people clean. on the whole temperature thing, we did get the thermometers that measure your temperature from your forehead or temple. And we started out trying to follow that regimen where the supervisors who, you know, they're people that have done well at making cutting dyes, so they became supervisors, right? Not medically trained. We had people lining up because the recommendation, this is where, Alex, we followed the CDC recommendation maybe too closely. we had some X's out in our parking lot, and we had people lining up before the start of shift. That lasted about, you know, the second or third day, I was going to have supervisors quitting. And it turned out that it, you know, later, so that it wasn't actually a very effective method, but we did maintain those, and we let people self-check, okay, and then sign in that they had checked. You know, some of these things really turned out not to be that effective, but yet when we've had a case, and we've had several cases, I don't know, I haven't kept accurate count, but it's 5 or 6 cases we've had of employees getting sick with coronavirus. We have not had a mass spread. You know, we've had them come, you know, the biggest thing for us, the single biggest action that we did is we said, if you're sick, don't come to work. Sounds very simple, sounds ridiculously simple almost. But you couple that with what Alex mentioned, and you know, Eric mentioned, and Stephen, you buttressed from the legal perspective. If anybody does not want to come to work for whatever reason, this is the time. If you want to, you know, drink tequila on Saturday night and Sunday night too, don't come Monday. We're not going to have, the attendance program is, you know, it's suspended for the duration. You know, it's just, you know, supporting people. For example, when we called people back off furlough, which some of you maybe are going to do, the first blush when we called people back, you know, they're getting an extra $600 from the federal government if, you know, you're in a state that has its act together and is able to get you registered for unemployment. So, you know, some of our people make more right now on unemployment than they do working in our factory, which tells you something about our wage rates, right? Our wage rates are fair, believe me, but they're just not quite high enough to take full state unemployment plus $600 from the federal government. That's equivalent to 23 or 24 bucks an hour straight time, right? So, you know, we called people back, and some people said, hey, I'm not comfortable. And, you know, so we then, that starts a conversation about, here's the steps we're taking to protect you. When do you think you might be comfortable? Well, okay, you know, let's go another couple of weeks. You know, so when we called people back, you know, sometimes they said a couple of weeks, so we kept in touch with them and, you know, kept them up to date and kept them getting more comfortable so that we've got almost everybody back now. You know, we did that through that sort of process, again, of leadership, guiding them, sharing the facts, telling them what we're doing, and getting them comfortable with coming back. Can't force them, but at a certain point when we have called them back, and we've only done this a couple of times, you know, we got to a point where we said, look, the job is open. This was an artist in, you know, does graphic arts for us. We said, the job is open. We need you. We need you to come back. And, you know, when he didn't, we said, look, it's our obligation to tell the government that you're no longer eligible for unemployment. Now you're staying out on your volition, you know, beyond, you know, this guy doesn't have, you know, that we know of, comorbidities like Alex was talking about, and, you know, could come back. Anyway, and that also affects your FTEs. Now that's under the 3P loans, you know, so I know I'm getting pretty far afield, but, you know, we did in this case say to the guy, come on back. We're ready for you. We've got you basically in you know, we need you to work. Hey, I think in that guy, we even offered to let him work from home. He's doing graphic arts work. He can work remotely. Anyway,
Well,
there are some odd cases that occur. You can't have one size fit all every time. And I think the gist of my message I want to say is, you know, we just helped people make the decision to return to us. So that's all.
And I'll just add a couple of things, because I think what you guys just went through are all of the topics that, you know, pretty much every business that I talk to now are thinking through in terms of how do we get people back into the office. And the only other two things that I would kind of add to that is that if you guys are collecting any kind of personal health information, medical information, so temperature checks, or if you're asking people to fill out a self-evaluation of, do I feel sick? Do I exhibit any, you know, COVID symptoms? And you're gathering that information, you just have to make sure that you keep that information confidential in a separate place, separate and apart from their employee files, and then make sure that nobody's getting access to that health information. Because that's the only other issue that I see a lot of folks that we haven't really talked about through you three.
Hey, Steve, you know, I mentioned that we had somebody who showed up sick and was sent home on a Wednesday, and we had like 24, 25 people take off that afternoon, you know, and not come back from lunch, and we had to talk them back in off the ledge. You know, it was very important that along those lines, you know, this fellow's name was well known. Everybody knew this guy, and yet we're in this sort of compromised position. We, you know, we can't share his medical information with them, and yet it's gone around the whole plant floor that so-and-so has such and such, you know. So our HR guy that I mentioned before, who's really helped me stay between the rails on this, said, look, we can't mention names as we are talking, and we can't do it on the phone, on one-on-one conversations. We can't do it in the plant, you know, et cetera. So yeah, it's kind of tough. People know everybody, and, you know, but you can't talk about people by name.
Yeah, well, I mean, you're leading me into obviously a lawyer's favorite topic, which is, you know, liability and potential liability. And so the next question is, you know, as you're thinking about all of these processes and you have all of these employees, you know, in your facilities, you know, how are you looking at liability issues? Are you guys worried about, you know, worker comp claims or, you know, any other types of, you know, COVID related liabilities as you go about your business? And maybe we'll start with Alex there.
Yeah, I think that, you know, again, I'm differentiating between our treatment centers, which is a whole nother ball of wax. I'm happy to talk about the complexities around executing protocols there for a variety of reasons. So even in that case, we tried as much as possible to keep it simple. The second part, when it comes to our office, which I'll call it just our headquarters, basic kind of office structure, no customers are coming in. It's our accounting team, it's our call center, those kinds of things, our corporate team. And it's really about simplicity. We've taken the approach and just think about the principle of design, KISS, keep it simple, stupid. And I think that to Steve's point about if you collect private health information, you now need to have a whole process for figuring out what different folders. So first, it's difficult to collect information, and then you've complicated it by choosing to do that. And temperatures. Well, who's going to do the temperatures? And like Al says, the supervisor don't know how to do that, and do they even want to do that? And so all of a sudden, these things, the CDC says, fill out a form, get their information, do a temperature check. All of a sudden, has compounded exponentially how complicated of an approach you've taken to open up your office again. And I'm not saying that you don't do that. I'm just saying that as much as possible, keep it simple. Keeping it simple, we're also, we believe, limit your liability. You can't be negligent. If you're negligent, you're liable. I also think that if you overcomplicate, you increase your liability. So either if you overcomplicate or you increase your negligence, your liability increases. If you take reasonable common sense approaches and you simplify, you minimize your liability. And so that's the big approach we've taken. Again, it goes with, if you don't feel comfortable, you don't have to come in. We don't mandate face masks. We're cleaning it twice a week. There's hand sanitizer at your desk use it every day. And so we try to empower them, right? We've had numerous recommendations that all have to do with them having to do certain things, not us. That we're not saying, hey, we're promising to do all these things for you. We're saying we're giving you the tools. You have to do all of these things. And like Hal said, if you feel sick, don't come in. If you've been exposed or think you've been exposed, don't come in. Other than that, come in and don't have 20 people in the conference room. And if you feel more comfortable wearing a mask, wear one. We have some that are offered. They're not required. Wash your hands all the time and use hand sanitizer, and we make it available. And so it's hard. It's when you just leave it at that. It's hard we believe, in our case, for the office situation on our programs, for there to be a scenario where we end up being liable for something. That's how we think about it.
Right. And how about you, Eric? How are you thinking about it?
Yeah, also like Alex, there's two different settings. We have the clinical setting, actually three, the surgical setting in the surgical center, and then the office here where we're at. So in the office, we don't wear masks. We're not patient facing. We're not, heavily trafficked. It's up in there's 15 of us. And then there's billing next door, the call center. So besides the core 15 and these groups that interact with patients, nobody else is really up here. We're attached to one of our offices. Now on the clinical patient facing side, there is masks required. It's more for the patient safety than, masks have a limited benefit. So face shields, our physicians, have the flexibility to wear what they want. We don't dictate, but we do require something. And so in our case, the physicians are 6 inches away from people's eyes and injecting and doing things. So, places that everyone else in the company can stay away from, our clinical team is going, face first into this environment. And especially with surgeries, you have all different things that can happen. So, that's the distinction. And really, to Alex's point, keep it simple, because if you make too many complicated guidelines, they're hard to follow anyways, and then you increase your liability just by default.
And Hal, how about you?
Well, Steve, you probably, being a fine attorney, advise me against this opinion I'm about to express, but our workers' comp insurance company issued guidelines that they will not honor claims for coronavirus. And in this case, I am taking their advice to heart, and we really haven't concerned ourselves too much about this. We just kind of, I've heard a lot of questions from people and, had various discussions with other CEOs. And I kind of came to the conclusion that, as in our personal lives, it's very hard for us to trace back how we got a disease or, and same in our work life. And I just decided that, based on the sort of standard approach that the legislature and the executive branch of government would probably be taken by the judicial branch as well. It's been taken by our private insurance company, ICW, so it's good enough for me.
And I think when you layer on all of the kind of other stuff that you talked about, you're doing your job to try to minimize the environment of liability, voluntary reporting and, all that stuff, right? So last question for the panel, and then maybe if there's questions, we can go to Q&A. But Eric, when we had talked about this originally, I think you quoted the great adage of not letting a good crisis go to waste. And so instead of just being reactive, kind of like Alex was saying, don't be reactive. What kinds of operational opportunities did you seize on to move the business forward? And Eric, why don't we start with you?
Yeah, so this is an exciting question for me because we hit the ground running. So I wrote some of the things we did from an operational perspective. And so I'll preface it, we were very busy up until COVID hit, which is a good problem to have, but we couldn't really do, bigger things. And so when we were facing 90%, deficits, which, could cripple the layman, and we would all be in fetal position in the corner crying, we thought this is perfect. We got some big roles that we need to fill. So the first kind of bucket here is we updated top leadership. starting with the controller. So under normal circumstances, changing a controller is pretty, impactful. I mean, distracting, the whole thing. So we knew that we had, the time and the capacity. So we changed the controller. We changed the billing manager, and we changed 2 of the 5 practice administrators. So the practice administrators, like the COO, and these were the 2 biggest practices that made up over 75% of the revenue. And so we figured now's as good a time as any. We're going to hire absolute A players and just upgrade them throughout the kind of downturn. And so we did that. That was the top leadership upgrade. We added new positions. So we added an accounting manager, a sales lead, and a call center manager to oversee our call center, no longer double dipping from our referral department. We did some marketing that we didn't do before. Typical doctors' practices have so much incoming volume that we didn't need to come up for air and ask for patients to come back, but we had to do that now. And so we found new ways to do that without being salesy, without while still maintaining the decorum of a surgical medical office, which we still have to kind of maintain. We still managed to secure a big partnership with one of our with a big PCP provider in the area. So we weren't, we were down but not out. And then we restructured reporting in some cases for our clinical department, assigned leads, just really got into the bread and butter of the org chart, and we had the time to do that. Here's one: we assessed the core competencies and assessed the skill level of everyone, top to bottom, and then we right-sized, either trained them to fill any skills gaps, or we put them on the right salary band. And so that would have been painful and uncomfortable in any other normal circumstance. But during this crisis, we figured we would, get everyone on the right salary band. They weren't. So that's what we did over COVID, and we're thrilled with all the results we've done.
How about you, Alex? Any opportunities that you see that you wouldn't ordinarily think about in this environment?
One of them, as I've mentioned before, is we took an opportunity to lead in the industry that helps build our brand and our reputation. We were doing a lot of great work internally. And so we noticed a lot of other people were kind of stumbling around in March and April. So we thought, hey, why don't we make this public? Let's get a Google Drive. Let's share the link and say, here's our protocols. And we started to use that too. We were doing webinars and also press releases and letting know our referral sources, what we were doing. And so we saw that as a win-win. I think in times like this, finding win-wins as much as possible. The other thing was actively talking, nothing per se happened, but actively talking to looking for acquisition opportunities. So actively talking to those that maybe are struggling and figuring out there's an opportunity to invest. Also combined, what we did end up capitalizing on was people, hiring some great people. So we were active in the market, talking to people, talking to programs. And there were other programs in our industry that shut down. We hired some great people during the crisis. And as a matter of fact, we opened up 2 programs last month, 2 new programs in the middle of the crisis. So I ended up hiring 75 people or so. And a number of those people were A players from these other programs that had closed. That as soon as we got wind of it, we immediately started to reach out to them. First, we reached out to the ownership of the programs and talked about, can we help you? Is there something we can do? Not directly, can we acquire you, invest, but what can we do to support you? And then we also started to talk to their people. And we talked about it in the way as not being a vulture, but listen, if you're laying off your people, if they're losing their jobs, we can provide a soft landing. If there's a way for us to provide an investment, or if we can just coach you so you can stay open so you keep jobs. And we really talked about that as an opportunity as us as Embark, that we have strength with our people. Is one of the roles we can play is that so many other companies are laying people off. We have an opportunity to hire people. Let's find that opportunity, not sit back and just and so it's a win-win in that sense. Is, hey, we bring out great people, but we also feel like we're doing good. So bringing on great talent, building the brand of the company by being a resource to others in the industry. I would say those are and then, you know, always the opportunity to reinforce your culture. It's really hard when you're a broken record and you talk about your core values just every month in your town hall or every week, and everybody's like, blah, 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 blah. But then you have something big happen and you talk about your core values and culture. Those are opportunities are when those culture aspects really start to soak in and sink in with people. So don't miss that. Don't miss that opportunity to double down on your culture, because it can really, and it solidifies your A players in your team. That, you know, it's less likely that they're going to leave when they feel like, gosh, I love being a part of a company that stands for something.
Yep. Great. Thank you. And Hal, before we get to you, so MK, I know that we're a little bit over time now. I don't see any questions in the chat, but maybe Hal, I'll give you a quick 2 minutes to respond, and then we'll open it up to questions to see if there are any, okay?
I only have this one thing to say. You know, we never were more than about 25 to 30% off, exception New Jersey, where we hit 45% early on. But so we didn't change operations in any great way. The thing that I think we're going to take away from this, though, is greater trust among our team, better cohesiveness, better alignment, better engagement. You know, like I say, an opportunity like this to provide leadership doesn't come around every day. Let's look at you know, we were handed lemons, let's make the lemonade out of it, and, you know, really build the engagement of the team. We've lived through a battle together. It's like, you know, now we are going to look back on this and say, hey, we survived, we helped each other, we trust each other even more than we did before. And I'm going to take that to the bank, folks.
Great. Thanks, Hal. So MK, I want to bring you in here to see if, I don't see any questions in the chat, but we'll open it up to the floor. Does anybody have any questions for our panelists? All right. So I don't hear or see any questions in the chat. So I think, MK, do you want to say any final words before we check out here?
No, I would just say thanks to the panelists for giving their kind of practical advice on how to navigate this. And if any questions turn up, by all means, reach out directly to any of the panelists or April from the SFA, or even me or Steve. But many thanks for everybody for attending, and for our panelists in particular.
Hey, thank you, MK, and thank you, Steve.
Pleasure.
Excellent.
It was great job, guys. Thank you.
Have a great weekend.
You too.